I am not going to talk of leadership in medicine. That is your field. That leadership is something that you have to give when a patient is brought, and especially when you are in an institutional environment. Those are individual decisions that doctors have to make. Since you mentioned about what the government has done, I thought I'll share with you the thoughts that we are going through on these issues and how we look at the future, because we have to look at the future in the long term. We are all going through transformations. Now what we have done is at the moment is stabilization of the economy. That is, we come back to a position that we are capable of paying our debts. So we have reached that. I think we finished the discussions with the IMF, and by June, July, I hope to discuss further, come to the agreements with the creditor nations and the individual creditors. So by July that we are no longer a nation in debt, so the normal banking system can operate. But it means we will also have a longer period to pay the debt till 2042 and a period of grace. But at the end of it, we have to pay the debts. It's not the problem there. It is that we'll have to take more debts because we are an import-dependent economy. So our first one is the restructuring of the economy to become export-oriented economy by 2035 onwards, certainly by 2040, so that we have no issue of repaying our debts. So that's fast growth. There are many aspects to it. I am not going to discuss that. Secondly is when you have fast growth, you must not have a big disparity between the people. So we are committing ourselves to reducing the multi-dimensional poverty in the country. Generally, a well-developed country would have 7 or 8% multi-dimensional poverty. We are saying the maximum is 10% by mid of the next decade. So multi-dimensional poverty is everyone must have access to equal education. A second issue is the disparity in regard to the medical sector and the medical services we can give. Today it's different. You know all the illnesses that are associated and new pandemics that can come. So how do we gear our health system? I don't think we can do the way we have been doing. Then what do you do about our hospitals? How are you going to equip them with artificial intelligence, robotics, all coming in? The whole medical scene will change and it's going to be more expensive, but we should certainly ensure that our people have a good medical service. So if you plan now in the next 10, 15 years, you can go ahead. 10 years to see how you do the transformation. The more we grow fast, the more exports we have, more resources we have for the education and the health sector and even housing. So those three is something we are all committed to though you have an open market economy. So in this, the key issue is going to be health. All this has to be discussed rationally without politicizing it, and then to look at how we go ahead.